When people think of a health system, they think of hospitals and health centres and healthcare workers and doctors and medicines and equipment. They think of all, if you like, the hardware of the health system. But what makes a health system run is information. You need information around all of those topics in order to make everything fit together and run effectively. And WHO, I worked for many years in WHO, and they would always describe the building blocks of a health system. But a health system is the way those building blocks interact, and the information is the part that helps it all run together.
What I have deliberately done is focus on civil registration and vital statistics. In my view, after 22 years at WHO and almost 30 years in this business, a country that does not know who is dying of what and what their birth rate is like has, in my view, a very, very poor basis for a health information system and therefore a system to guide its policies.
We have to know why people are dying and what are they dying from. If we don't know, as public health officers, then that means we will have no idea how to advise policymakers and also politicians and administrators.
We really need these vital stats for our senior managers for planning, like building health centers, and we have to come up with the population, and it's very important.
Well, I would consider it the most vital piece of data for mortality information, mortality related information, and this would be the single most complete source in my opinion.
We know that in Samoa that most of our death certification is done in hospitals. Those are referring only to inpatients. We know for sure we're not capturing what's happening outside.
I mean, I think one thing was the use of the assessment, the civil registration assessment guideline, because that's been, nobody else had developed anything like that. That doesn't exist anywhere, doesn't exist in the UN system. So it's very innovative, and that's been rolled out in a number of countries, and I think has really helped build momentum around the issue.
But we focused on that in part because the global momentum is turned rapidly towards civil registration and vital statistics. So we've seen an opportunity where the hub, with its partners, with its engagement strategies and success, where we can draw in partners to help create tools which we then embed in these work programs of international agencies, as we've done very successfully, and then see it roll out across countries.